there, we use probably the non-absorbable suture, right? That's done. All sutured, then you give me the gauze as well. So all it's already closed. This time, we extract a wisdom tooth. So it's big. You're not gonna give me another one with all just like this, right? So probably you give me 2 or 3 gauzes, fold it, make a pressure pack, and then probably you just put it, fold it into half. Because it depends on how big the extraction site is, right? And let it bite. Okay, so once biting, for surgery, you will always have to have a written and a verbal instruction. Always verbal and written. So you give it verbally, but you will also give them a written instructions, because especially if they're sleeping, maybe they're not sinking in where you're telling to the patient. But that's why you always have some verbal and written instructions. So mostly what's gonna happen is pain, bleeding, swelling, diet. That's the most instructions that you can give. For example, bleeding. How do you stop bleeding? Pressure pack, right? You ask the patient, keep biting into this gauze for at least 30 to 45 minutes, right? But in between, if you feel like there's blood, there's still a lot of blood, you can keep on changing it. But within 45 minutes, remove the gauze. If it still is red and bloody, we give you extra gauzes, right? Keep on biting into this again. Do that for at least 2 times, right? Now, for example, you're already at home. You kind of give that scenario to the patient, especially if you feel like here he's already bleeding a lot. How much more at home, right? So this is to stop the bleeding. We're just stopping the, you're already bleeding, but you have to stop it. Now, gauze. Now we got home, there's no more gauze. How are you gonna stop the bleeding?
Cotton.
Of course, you're gonna call the office. Like, how? Okay. For example, the patient calls you, right? Okay, I am already at home. I'm still bleeding. I have no more gauze. What do you want me to do? Like if you ask me, okay, come into the office, but it takes me an hour to get to there. What am I gonna do? At home. What can you do at home?
Ice pack.
No, bleeding. We're talking about bleeding.
Cotton.
Cotton? No. Your cotton probably is not sterile. Gargle? You're gonna
No,
promote
no,
bleeding.
Towel.
Towel? Very good. You're wrong. So we have the you have always for sure at home you have a tea bag. Yes, a tea bag.
Tea bag.
You moisten the tea bag. It has to be in a bag, not the loose tea.
Oh yeah.
Right?
I read that
In a
from
bag.
the
You're the-
written one.
So you moist the tea bag, not dripping wet. Just moist it, remove the water, and bite into the tea bag. Why?
Sorry, moist it with like
Water.
room temperature.
Room
water
temperature,
or-
yeah. Room temperature water, moisten the tea bag. Why is the tea bag? What's in the tea bag?
Tea.
Tea.
There's a
Of
cloth.
course.
There's a cloth to cover the tea.
Tea bag is acidic.
Oh,
Acid. And your blood is
Acidic.
base.
Tea bags.
So the acid and base comes together, will help stop the bleeding. So that's why there's a tonic acid in the tea bag.
Tonic acid.
I don't know. They said that. I just.
It doesn't matter if it's green or.
It doesn't matter what tea, but it has to be in a tea bag, not the loose tea or the loose tea will go.
tea or
Yeah? Huh?
If we don't have
Chamomile tea.
different.